Hi, this is Sarah of Sarah Geist DPT, Myofascial release. Today we're going to do a release for the iliotibial band, also referred to as the IT band. This is a band of fascia that comes along the side of the leg. It crosses over the knee and attaches in to the lower part of the leg, and it starts at a muscle up here in the top of the hip. So, and it really is pretty broad, so it can kind of take up the whole outside of the leg. A lot of people, especially runners, will have issues with this area, especially if they have some weakness in the hip and they're requiring other parts of their musculature to take over and help out. That can kind of create some residual tightness down and through the side of the leg. So there's lots of usually pretty fertile ground for areas to be released through here for people. So you can really work anywhere from up into the hip joint, down the leg, to just above the knee. You don't really want to work right on the knee joint, so you want to make sure that you're staying just above the knee joint. And so with this, you'll want to have the 4-inch Sport Time All Ball that I've talked about before. Tennis ball, a lot of times people are using a tennis ball or a foam roller for this, and that can be pretty intense. You can do a foam roller, or a foam roll, as I like to say, but you don't want to be rolling over top of this area. Not only is it pretty uncomfortable, and so remember, your body actually is giving you messages when your level of discomfort is high. Your body's telling you, oh wow, this is a bit too much. But if you can soften into that discomfort, you can soften into discomfort when you're in a stable position, right? So if you're moving, you're constantly, kind of feeling discomfort and then not feeling discomfort, feeling discomfort and then not feeling discomfort. Whereas if you can stay right on that barrier, that edge between there being a little bit of discomfort there, but you can soften into it, then you're able to kind of be with that and allow that to shift, versus constantly kind of reacting to that. So you're going to have your knees bent to start, and again, you can kind of find where you want that to be. Like I said, you can use a foam roll for this, or you can use the ball. I find the ball works very well. And you can, again, kind of play around by moving the ball up and down. For most people, it's pretty intense to be kind of down by the knee, especially if the knee is straight. So again, you can kind of play around with straightening and bending, and see what feels like it's getting to the area that you need the most relief from. So for me, that's about it right there. So once you've found your spot, then again, you're kind of coming into settling in, right? So if you need a pillow under your head, anything to kind of allow yourself to be nice and comfortable here. You can also play around with where that top leg is. Sometimes it's a little bit too much to have the top leg resting here. You can even kind of take it down. You can take it up and over, wherever feels like it works for you. For me, having just a little bit of pressure, but not too much, feels pretty good. And then your job is to really allow yourself to feel. So remember, it's not the pressure that's necessarily doing the releasing here. So meaning that more pressure isn't going to cause more release. This isn't a no pain, no gain kind of thing. It's not about how much you can withstand. It's about finding the barrier, the area where your body is able to really relax into the pressure, and that's where the shifts can happen. And so in order to do that, you need to be able to feel what's going on. If it's so intense that you are distracting yourself by thinking about other things, then you're not allowing that energy to go to that area. And so when I say energy, what I mean is when you focus on that area, when you take your awareness there, it actually allows blood flow to go to that area. And that's really, really helpful when you're trying to relax or release something. So allowing that focus to go there. Again, just allowing your breath to be what it is. So you're not here trying to take the deepest, longest breaths ever. You're just being with the sensation and feeling, and your breath will shift and change with that. So ideally you're hanging out for 3 to 5 minutes. You can do a little bit on the other side, coming off of that, pushing yourself up, and then you can pause in the middle for a moment, just kind of notice the difference left to right, and then come down onto the other side. And again, what you are looking for, what you're finding left to right, might be a little bit different. So allow yourself to kind of play around a little bit and notice what you feel here. And then again, when you find that spot here, figure out where the rest of your body wants to be to kind of support you through that. And then allow yourself to start to sink in and relax and release. Closing the eyes can really be helpful. When our eyes are open, we really kind of get distracted by what we see visually. So closing the eyes can allow you to go into sensation. You can use some visualization here if that feels helpful. A lot of times I give the visualization of cheese melting on a hamburger or something like that. I think that can be a really helpful visualization when you're lying over a ball. But other visualizations can be helpful as well. A lot of times, just kind of, if I can just visualize or feel that area not being held rigid, and that there's some kind of space or room for movement to happen. So it's kind of a nebulous visualization, but it's the best way that I can describe it. Just kind of letting there be an allowance of shifting rather than really trying to hold tight. A lot of times when we do stuff like that, it's like, okay, I've got it on the right spot, now I can't move it all because I want to make sure that I keep it on the right spot. And with this, actually, you want to just let yourself soften in and soften over, so that as things start to shift and change, as releases happen, your fascial system and the ball and your body and your awareness will shift to where there still are some restrictions that need to be let go. So rather than holding yourself rigid over the ball or on the floor, you're kind of allowing that shift to happen. So, for example, right now, as this is starting to let go a little bit under the ball, I can feel my body softening into more of a rotation. And that's actually creating more of a stretch between the outside of my right hip and where the ball is. And so, like I said, with that softening versus holding rigid, that allows the stretch or the release to go and shift into a different area where it needs to be releasing. And that will happen naturally. You don't have to force that to happen. So again, if you're doing this on your own without the video, 3 to 5 minutes is what you're shooting for. You can always stay in releases longer if you feel like something is happening and letting go. You can hang out there and allow that to keep happening as long as you're able to stay focused and aware. Just come off of this. If you find that you're not able to stay focused and aware, then it's a good time to kind of stop and go on to maybe a different body part or go on to a different activity. So hope this has been helpful for you. As always, you can shoot me a message, leave a comment, let me know if you have any questions or if you have any other areas of your body that you feel like would be helpful to get into a little bit. Thanks so much and hope you're staying well. Take care.